Today we'll be discussing pathologies that can result in a total hip replacement or total hip arthroplasty and a summary of the surgery. A total hip replacement is most commonly performed due to osteoarthritis of the hip. With age and use, the articular cartilage of the hip joint can degenerate. The articular cartilage becomes frayed and rough, which exposes the bony surfaces beneath and makes movement painful. A previous injury, bony abnormalities of the femur or acetabulum, repetitive stress from physical activities, and weakness of the hip stabilizers resulting in increased compression through the hip can all increase the likelihood of an osteoarthritic condition. Other risk factors such as obesity and a genetic disposition to arthritis may also play a role in hip degeneration. Severe osteoarthritis is by far the most common indication for performing a total hip replacement. While less common, rheumatoid arthritis, an autoimmune disease in which the synovial membrane surrounding the hip is inflamed, can lead to a total hip replacement. Avascular necrosis, a condition in which blood supply to the femoral head is minimized from a traumatic injury, fracture, or disease, can cause the femoral head to decay and warrant a total hip replacement. Sometimes a childhood disease can result in abnormal hip development that leads to an early onset of hip degeneration that requires a total hip replacement. Symptoms that indicate a need for total hip replacement include hip stiffness, pain, and poor functional mobility that is very detrimental to a person's quality of life and is not responsive to conservative approaches like physical therapy, medications, or injections. A total hip replacement involves both components of the ball and socket joint. The degenerated femoral head is removed. A metal stem is then inserted into the hollow middle of the femoral neck. Attached to the stem is a prosthesis made of biocompatible metal or ceramic that replicates the ball component of the femoral head. Next, the damaged articular cartilage of the acetabulum is removed and replaced with a metal socket that is screwed or cemented in place. Finally, a plastic, ceramic, or metal liner is inserted between the new ball and socket to improve joint congruency and provide a smooth